Hello everyone, this is Dr. Nasser, and in this clip we are going to look at chronic lymphocytic leukemia, also known as CLL. CLL is a leukemia that is quite often seen among older patients. However, it is not unheard of to see CLL among patients that are younger, around the age of 30s and above. But usually CLL is commonly seen among patients more than age of 70. This is a low magnification that you're looking at on the screen, and at the first glance you should observe the fact that the white count is elevated. There are increased number of white blood cells, and these white blood cells, they all only two distinct morphologies. One appears like a lymphocyte at this magnification, but we are not going to identify the cell until we go to higher magnification. And we have these cells in here that they are referred to as smudged cells, or also known as basket cells. And these are the cells that have lyse. They have broken. The membrane has fallen apart, the nucleus has fallen apart, and the cell has become smudged because in CLL, the membrane of the lymphocytes becomes very fragile, and making this slide, these basket cells develop at the time of slide making rather than in vivo in the body. They are not like this in the body. They become smudge cells when we make the slides because of that fragility of the lymphocyte membrane. I would like to go to higher power to be able to show you some of these cells, and you can see this lymphocyte. First, it appears like a normal lymphocyte, but you need to pay attention to the size of the cell. This cell is about 1.5 to 2 times larger than a red blood cell. So this is going to be relatively large cell, but it is not a blast. It is much smaller than blast cells. The nucleus, the chromatin pattern is less condensed, and basically they are large lymphoid cells with a pale cytoplasm. They may have sometimes pale basophilic cytoplasm. Less condensed chromatin than the normal lymphocyte, and sometimes they do have a distinct nucleoli present inside the nucleus. So I can see a nucleolus in here, and perhaps a couple in here, but you often can see nucleoli in these what we refer to as prolymphocytes cells. These are not mature lymphocytes. And when we go across the screen, we do observe that all cells have similar morphology. They appear to be similar in their appearance and in their morphology. That's a very important clue. You see increase in white count. When you look at the blood smear, you see large lymphocytes. The nucleus is less condensed. You may be able to see the nucleolus, as you can see in these two cases. And you have the presence of smudge cells. That is also an important finding. Smudge cells are most commonly and most abundantly seen in CLL. That does not mean that you don't see smudge cells in other conditions. It's just a matter of numbers. The number of smudge cells in CLL, to my knowledge, is the highest that we may be able to see in a blood smear. So, increased white count, increased uniform lymphocyte looking cells, but they are not lymphocytes. They are larger in size, and indeed we refer to them as prolymphocytes. However, on your differential you can include them as lymphocytes. And of course, the presence of smudge cell is another indication that this case may be a CLL case. It is very difficult to identify CLL subtype based on morphological characteristic, and flow cytometry studies are required to identify the presence of antigens on the surface of the membrane of these lymphocytes in order to determine what subtype of CLL we have. Majority of the CLLs, I would say about 85%, are B CLL, but TCLLs are not unheard of, and you may be able to see TCLLs as well. Again, remember when you go through the smear, large lymphocytes, homogeneous in their appearance, as well as the presence of smudge cells. These three categories, leukocytosis, uniform population of large lymphocytes, and smudge cells, should raise the flag that you are looking at a blood smear with CLL. Further analysis is required to identify the exact class and subclass of CLL.